Буна Деменяца, здравствуйте.
Bună dimineața! Doamna Marchitan, mă auziți?
Здравствуйте.
Я думаю, что мы можем начать, потому что 9 часов и 2 минуты. Меня зовут Лина Кудима, я координатор сети сотрудничества и рада вас приветствовать на нашем вебинаре, приобщенной сети сотрудничества и посвященным вопросам регистрации лекарственных средств и обеспечения доступа к новым препаратам.
Of medicines and providing access to new TB medicines within TB-RAP project. The webinar is organized jointly with the WHO Regional Office for Europe and Center for Health Policies and Studies in Moldova. Today's topic is secure procurement of quality assured TB medicines and continuous supply of TB medicine in the context of transition from donor to national procurements. I would like to mention several technical issues. The webinar is held in Russian with simultaneous interpretation into English. If you have any questions or comments, you can write them in the chat box. I would like to also inform you that today's webinar is being recorded, and those who don't have possibility to be present will be able to watch it later. About today's agenda, we would like to continue the working process and cooperation within the collaborating network of TB-RAP project, as well as to inform the participants about the secure procurement of QA-TB medicines and continuous supply of TB medicine in the context of transition from donor to national procurements. And last but not least, we're going to present a country review for Kazakhstan, Moldova, and Uzbekistan in terms of quality assurance in procurement of TB medicines. About the TB-RAP project and its role in facilitating TB medicines procurement, I would like to give the floor to representatives of the Center for Health Policies and Studies, PAS Center, Kristina Chelan. Please, Kristina, the floor is yours. Good morning, dear colleagues. I'm glad to greet to all participants in the webinar dedicated to the topic of secure procurement of
поставок противотуберкулезных препаратов в контексте перехода от донорских к национальным закупкам и пожелать успех вебинару. Данный вебинар проводится в рамках проекта TB-RAP 2.0, который инициировал и поддерживал развитие межстрановых сетей сотрудничества по обеспечению доступа к своевременным лекарственным противотуберкулезным препаратам. Региональный проект сфокусирован на укреплении системы сообщества, а также преобразовании системы здравоохранения для улучшения ответа на туберкулез. И в данном направлении по доступу лекарственных средств преследует следующие задачи. Во-первых, задействование трансформации на уровне системы здравоохранения. Второе, переход от модели, в котором ориентируется на болезни, к модели, в центре которой является человек. Третье, интегрировать услуги в общую систему здравоохранения. И последнее, доступ к недорогим и качественным препаратам. Тоже одно из направлений TB-RAP для улучшения способности успешного лечения туберкулеза. Вместе с опубликованием в 2019 году нового руководства ВОЗа о ведении совершенствования лечения МЛУ-ТБ с применением краткосрочных схем лечения с пероральной терапией, страны в быстрых темпах переходят к новым схемам лечения. Многие из этих новых схем лечения пока поддерживаются в основном глобальным фондом, но многие страны уже инициировали закупки в рамках государственных закупок. Осуществление успешного перехода к государственному финансированию связано с способностью стран организовать надежный механизм закупок. В переходном периоде практически все страны столкнулись с целым рядом факторов, препятствующих построению эффективной и устойчивой системы внутренних закупок. В национальном законодательстве по закупок часто используются другие стандарты, чем в донорских организациях, и применение механизмов в большинстве случаев не соответствует передовому опыту и не могут обеспечить качественные и стабильные поставки и экономическую доступность для противотуберкулезных препаратов. Для устранения существующих барьеров нередко требуется изменение на уровне законодательства, реализация последовательных шагов по пересмотру соответствующих механизмов. Участие в международных совместных закупок, включая закупки за счет бюджетных средств, представляет собой одно из решений, которые позволяют странам обеспечить стабильные закупки и поставки лекарственных средств заверенного качества, а также позволяет дополнительно снизить цены и обеспечить стандарты качества. В данном контексте страны разрабатывают усовершенствование систем закупок и заинтересованы в обмене опыта в правовых механизмах, разработанных для проведения экономически эффективных закупок. Поэтому мы сегодня предлагаем такую возможность: обсудить разносторонние аспекты проблем, связанных с закупками противотуберкулезных препаратов, с которыми сталкиваются страны, а также обсудить прогрессы, реализованные некоторыми из стран, которые задействованы в данных процедурах. Спасибо всем огромное и желаю плодотворной работы.
Спасибо большое, Кристина. Коллеги, наш вебинар откроет Айгуль Сыздыкова, начальник управления стратегии СК фармации Казахстан. Госпожа Айгуль, вы готовы?
Да, здравствуйте, коллеги, да, я готова. Здравствуйте, уважаемые коллеги. Во-первых, позвольте поздравить вас с наступающим Днем независимости Республики Казахстан и поблагодарить организаторов за возможность участия в этом важном мероприятии. Позвольте представить вашему вниманию систему единой дистрибуции Казахстана.
To present your attention the unified distribution system in Kazakhstan and the situation as per 2021. This slide presents general information of the state benefit package that amounted for 44% in 2022, just like in 2020. 25% were covered by the compulsory social and health insurance and 31% by the population. The healthcare services providers amount to around 1,500 in Kazakhstan, of which about 800 are private. The share of pharmaceutical market in Kazakhstan is worth 1.5 billion USD, of which 37% amount for the public channel, and 66% of the public pharmaceutical market are provided for by SK Pharmacy, of which 40% go for the hospitals. SK Pharmacy is a single distributor that follows international quality assurance standards and strict international requirements, ensuring quality of medicines and medical devices. SK Pharmacy procures and provides supplies to both hospitals and healthcare centers, to all the health facilities, and covering 131 nosologies for all the population of Kazakhstan. As of the end of 2021, the overall procurement by SK Pharmacy from this statutory free medical assistance and compulsory social health insurance amounted to 75.6 million USD. Next slide, please. A couple of words about the history of unified distributor creation. The system of unified distribution was founded in Kazakhstan in 2009 in order to consolidate procurement of medicines and medical devices at the national level. In the same 2009, the limited liability partnership SK Pharmacy was assigned as the unified distributor in Kazakhstan. The main objectives of the unified distributor is to support the local manufacturing of medicines, as well as to ensure permanent supply of the necessary products on the Kazakhstan market. A couple of words about the mechanisms and the order of procurement by the single distributor. We have 4 types of procurement: long-term agreements with the local manufacturers, 10-year agreements that we sign with our local producers of healthcare products. And I will tell you more about this mechanism in the following slides. We also procure products that do not have analogies by directly contracting foreign manufacturers. In 2021, we procured such products worth around 55.2 billion tenge. On the slide, in the second column, you see the main top 10 manufacturers: Pfizer, Glaxo, Novo Nordisk, Boehringer, Novartis, Sanofi, Takeda, Vetter, Baxter, and Janssen. These are top 10, but we have around 30 direct contracts signed as of today, and 88 long-term agreements with the local manufacturers. We also have a procurement mechanism of medicines for socially important diseases through the international organizations. In 2016, SK Pharmacy signed an agreement with UNICEF, due to which Kazakhstan has managed to extend the coverage of HIV patients from 6,000 to 18,000. Since the 1st of February 2018, the agreement between UNDP and SK Pharmacy is in force, and we have managed to extend the coverage of hepatitis C patients from 4,000 to 18,000. On the 16th of May 2019, we signed a project agreement with the UNOPS, stop-TB partnership, in order to procure multi-resistant TB medicines. And thanks to bedaquiline application, we have managed to increase the efficiency up till over 80% in treatment of MDR TB. And the treatment period has reduced from 32 to 18 correspondingly. And the rest of the products that we do not procure from our local manufacturers or from foreign manufacturers and through international organizations, we procure them by organizing tenders from local distributors. Currently, we are moving towards automating this procedure fully in order to exclude corruption risks and human factor. Next slide, please. A couple of words about the results of our work within the last 10 years. The volume of procurements have been growing through the single distributor from 31.3 billion tenge in 2010 to 278.5 billion tenge in 2021. Procurement through a single distributor allows saving budget as well as extend the number of procured products. And first of all, we focus on the local procurement, and you can see on the slide that share amounts to 44%. About the effects, about the impact, first of all, it is about the equal price for over 2 million patients and quality medicines, because before that, prices used to differ between different regions. By now, we have managed to level that price to ensure equal access for all citizens. Secondly, the impact concerns centralized procurement for over 2,000 health facilities, which allows saving budget money. And within 10 years, due to this procurement procedure, we have managed to save over 162 billion tenge. The saved funds go back to the budget and organizations in order to cover for their needs. The next objective is to support local manufacturers and to increase their share on the domestic market. And there has been positive growth within 10 years from 15 to 44% of that share. And by 2025, we have a target to increase this share up to 50%. And procurement through UNICEF, UNDP, Stop-TB, and direct contracts, that is procurement without distribution margin. And again, it saves 20% of the budget correspondingly. Next slide, please. I would like to mention that in 2019, the single distributor procured products for 45 nosologies. But since the 1st of January 2020, the system of compulsory social and health insurance was implemented in Kazakhstan, which allowed us to cover 137 nosologies. So within this state benefit package, we cover 32 nosologies and 105 nosologies within compulsory social health insurance. So that's a 5-fold increase, while the burden on the budget increased only by 38%. A couple of words about the activities of SK Pharmacy in the context of COVID-19 pandemic. Since February 2021, we have procured 5 types of vaccines and delivered 20.1 million doses. We have 3 type vaccines developed now. Sinopharm, Sinovac and Quasvac, that is a domestic manufacturer. And since November, we also have Pfizer available. Regarding TB medicines procurement, bearing in mind that SK Pharmacy procures medical products based on the approved list by the authority, of which 29 positions refer to TB medicines. We have procured 25 positions because 2 azoniazid and Afamycin haven't been procured. There haven't been any offers from manufacturers, but our patients didn't have to suffer because the treatment regimens were adapted to the doses and the medical products that we had procured. So 11,000 patients were provided with all the necessary medicines. We procured medical products with 13.4 million USD. 2 positions were procured through Stop TB partnership. 8 are manufactured on the territory of Kazakhstan and have been procured based on the long-term agreements signed with domestic manufacturers. 2 positions were procured from foreign manufacturers based on direct contracts. Apart from procuring innovative and efficient medicines through Stop TB partnership, it also allows us to save significant amount of money, which reduces the burden on the public budget and lets us reallocate those funds for other needs. A couple of words about the logistical system of SK Pharmacy. We do not have our own deposits. We outsource storage services from local businesses. We have 6 suppliers of logistical services, storage and transportation of medicines. We have 4 main major hubs in 4 regions, in Nur-Sultan, in Almaty, Shymkent, and Aktobe. And each hub services the corresponding territory through transit operational deposits, which are 17 all in all. It allows us to respond to the needs of the population and the health facilities on a timely basis. And I would like to say a couple of words about the mechanism of procuring medicines from our domestic manufacturers based on long-term agreements, which helps us in terms of ensuring national security in Kazakhstan. This share has grown twice. We have 89 agreements with 35 manufacturers signed for over 4,000 positions, 4,700 positions of medicines and medical devices. This slide presents briefly how we work based on long-term agreements. And so we sign these agreements for 10 years, and the manufacturers have a certain niche. Also, if they comply with all the requirements regarding quality and timely deliveries. SK Pharmacy signs agreements only with those manufacturers that have GMP and GDP certificates. About the mechanism as such, annually SK Pharmacy creates a list of nosologists and presents them to the Ministry of Health that approves the lists, after which the competition is announced, a tender for domestic manufacturers for awarding long-term agreements, and the manufacturers apply. Once in 6 months, we review these agreements and we evaluate compliance with the requirements by the manufacturers. And if the manufacturer doesn't comply, the agreement is terminated. If they comply, and when there is a need, manufacturers supply and deliver the necessary medical products. Apart from signing long-term agreements, according to the government's decision, it is also possible for big pharma to enter the market. We have an order regulating this procedure dated 2019. We are currently working on improving these provisions. We haven't signed any agreements based on this mechanism yet, but we are now working actively with foreign manufacturers, and hopefully next year we're going to sign a number of contracts for manufacturing based on contracts. These are top 10 domestic manufacturers in Kazakhstan. Around 48% of COVID medicines included in our clinical protocols are manufactured locally, and we're also planning to increase the share of domestically produced products up till 50%, as I have mentioned. In terms of pricing, they amount to 17% so far at the moment. This is the map of our domestic manufacturers, domestic brands. We have around 96 in Kazakhstan currently, but we have signed agreements only with 35 so far. This is information about our company. If you have any questions, you can always get in touch with us. Thank you very much for your attention.
Thank you very much, Ms. Aygul. Thank you for detailed presentation of your distributor and supply of drugs. Also, we thank you for presenting details about the legal considerations, and we congratulate you with the results you have obtained using such a system. Thank you again for such detailed presentation, and we can continue with another report prepared by Rita Seikash, Drugs Quality Management Specialist from Stop TB partnership. She will present the report on purchasing guaranteed quality TB drugs and uninterrupted supply in the context of transition from donor to national procurement. So I would like to welcome all the participants and those who accepted the invitation to this webinar, and thank you for inviting me as well. And I think that all the participants of this webinar know about good practice for purchasing drugs, and especially TB drugs. And in case they do not have a detailed knowledge, they know at least general criteria that guarantee uninterrupted supply and guaranteed quality. And today we will discuss with you what can be improved to maintain this high criteria. And we will also discuss the success of countries in purchasing TB drugs through international agencies. And also another question would be whether the countries are able to purchase TB drugs of guaranteed quality through national practice, and also what can be taken from the experience of international agencies, international practice. We will also discuss the key tasks of good practice in purchasing. We know that the way of drug towards the customer is a long one. It involves a lot of participants and it is guided by many requirements. These are represented by regulations, laws, and at each stage, each country should have a certain package of requirements to ensure the quality of each stage of the process. So this involves drafting the standards, also taking into account clinical practice requirements by regulatory agencies and inspections that have their own requirements for clinical trials, for surveillance at the stage of registration of drugs. You will see for the several times the abbreviation GRP, and you know what does it mean. And this should be maintained all over the process, at the process of registration, production, and so on. We also have such standards as international standards, then good regulatory practices issued by national agencies. And as concerns drugs for TB patients, we have requirements of good pharmaceutical practice. So some other requirements for the use of these drugs for patients so that these drugs are efficient, good quality, and that they correspond to a specific regimen required by the patient. We should not forget that our patients also participate in this system, because the patient has the right to apply to the regulatory agency or to procurement agency or laboratory with claims or with opinions regarding the quality of a drug the patient is administering. So we have to be very attentive towards the feedback from our patients. And what served as a context to raise this topic, quality of drugs and uninterrupted supply. We know that many countries of our region are in the process of transitioning from donor support to state financial. And we need to prepare this transition period to ensure the results for all the components of TB program. We should ensure uninterrupted supply of TB drugs that are needed, and these drugs should correspond to the latest recommendations. They should be of guaranteed quality, they should be effective and safe. But in different documents of international organizations, we can note some threats for the realization of these tasks. There might be the use of drugs of unknown quality. There might be a risk of interrupted supply because of shortage of producers and registered drugs in the country. For example, for new drugs, we can have only 1 or 2 producers. And as a result of ineffective system of quality insurance, we can run the following risks. Risks to select unreliable suppliers with unqualitative services. We can withdraw the drug from circulation, and it requires time for organizing new procedure for procurement. We might run a serious risk for health and the safety of our patients. It may involve also financial losses and high level of in the system of health. And let us discuss what mechanism do we have in the countries. There are countries who already purchase these drugs from a state budget. Usually we can state that first-line drugs are purchased by the countries on their own budget. Then we will have another mechanism of purchasing through international specialized agencies. And we have procurement from the resources provided by donors that are regulated by International Agency for Procurement, which is GDF, Stop TB Partnership. Some of the countries also provided humanitarian aid. I would also draw your attention to a source of data, which is analysis by WHO that concerns challenges and opportunities for optimization of ensuring drugs procurement in European region. You can see different criteria here on the diagram. And here, the question that concerns the challenges in procurement that were mentioned in this opinion poll. On the first place, we have quality. The second place takes limited competition, and also the optimal ratio between price and quality. So we can see that there are many challenges that were identified here. Also in this analysis, when concerning the question of the features of good practice of procurement, it was mentioned that the first place takes transparency, then goes competitive prices, optimal prices, and participation of certain partners in the market. This analysis was also based on specialized literature, and there are certain things that should be mentioned. As regards the quality, it was said that in many countries, the quality of generic drugs raises doubts, and countries have challenges in conducting activities in ensuring the quality of drugs. What concerns safety, it was said that we have to track side effects. And as regards the monitoring procedure, here it was said that the effectiveness of suppliers' activity is not taken into account. So also we have some cases when economic agents are not interested in starting the production of the drug because it does not provide good income and profit. So when we analyze our market, we have to understand how sound it is for us to implement our mission. So we also have to find out indicators that will allow to national agencies on procurement to understand whether the market is sound or not. So, for example, such indicators of market dynamics as availability, accessibility, quality. UNICEF stated that the indicators should be availability, quality, and these indicators should be taken by the agency on procurement. And we also have to take into account many other factors like influence of the supplier to the market, the volume of the market. So a lot of things should be taken into account to implement our strategic tasks for good procurement practice. So, and the strategic tasks are the following: purchasing of effective drugs from the point of view of economic aspects in the right volume. We have to select reliable suppliers, and we have to analyze all the expenses in a comprehensive way. So you know about the principles of good practice. We have 12 principles. We can group them in 4 categories. The ones that concern management, then selection and assessment of need. So we mean here the real need in these drugs. The 3rd category, competition and financing, and the 4th category, selection of suppliers and drugs. So we have to take here into account the reliability of suppliers, uninterruptedness of the process, and many other factors. Usually our procurement agency collaborates with many structures from state bodies, private sector. It may be distributors, producers, brokers, non-governmental organizations. And that means we have to be very transparent in our collaboration, and we have to use the resources provided by other agencies. So I would like to mention the critical characteristics in procurement. I have highlighted a few of them. And I invite you to write in the chat what are the critical characteristics you can mention. So the first thing is time of the procedure. So usually it takes 12 months at the level of a country. In case of international agencies, it is a long-term contract that involves a list of several producers. And we have heard about the experience of Kazakhstan, where it was mentioned about the diversification of sources. And therefore, many countries try to change this mechanism from tenders to long-term contracts, because as we have the time of treatment that makes up from 18 to 20 months. During this time, during 12 months, we have to take into account all the patients we have from the previous year and new patients, and we have to plan very good not to have interruptions in treatment. So a minimum supply of drugs, so we have 1 month when these drugs are stored at medical organizations, which is buffer volume that should be maintained. And it is very important to take into account the factors that influence on it to have a good planning. So the fourth critical issue is budget and payment for drugs, because it is related to the financial year, or it may be done after the receipt of drugs. In international agencies, they use the mechanism of advance payment. And this is one of the conditions of the international agencies. So it still has certain decisions to be taken. And then the fifth issue is the duration of procurement. So it may last for 5 or 6 months. And if we have tenders each year and it lasts for like 6 months, it will immediately influence other requirements and standards while making up the list of drugs. Then the quantity of registered drugs. We can have 0 or 1 or 2 drugs registered in the country, and it may influence the price, the quality. Then the number of distributors again may vary, and the term of validity also can vary. If we have tenders that last for a long time, then we might encounter some challenges, and all these factors should be taken into account like in a puzzle to be able to meet their requirements. So all the other critical issues, I hope you will write in the chat. So we work with a global fund, and we worked with global fund before. You know that global fund has very strict requirements towards quality. So it concerns the sources and quality of raw material, also production processes that should correspond to international quality standards. So all these elements should be reflected in our national documents as well. Once we will purchase the drugs from the state budget. And you all know that while purchasing the drugs from GDF, all the drugs should be either pre-qualified or approved by the regulatory agency. When the drugs do not meet the requirements of being pre-qualified or approved by the regulatory agency, then we have a special group of experts who consider this issue. So if we consider the work of this expert group, we see that this group considers the drug during 12 months. And it is very important for countries who purchase unregistered drugs, because when we purchase unregistered drugs, we have to pay attention to the certificates these drugs have. If we consider the activity of other agencies like UNICEF, UNDP, they also refer to the system of quality ISO, to the models proposed by WHO. They also collaborate with outstanding pharmaceutical agencies, regulatory agencies, and why I highlighted the requirements of all these agencies, because in 2006, when WHO, UNICEF, UNFPA were considering the differences that exist between pre-qualified drugs and registered drugs, they mentioned several challenges. So this concerns the producers, the agencies who procure drugs, and it was decided that the long-term objective of this system is unique criteria that will be based on pre-qualification of the drug and assessment of files of producers and suppliers, and therefore we will have operating system. So this model is based on 6 modules, and you maybe will study them in more detail. I would like to pay special attention on module 2, which is about pre-qualification. So, and other critical factors in assessment procedure, this assessment should be done by a procurement agency, and it should also involve the assessment of producer. And we have a model of the quality ensuring for agencies. And I also pose this question, whether it happens in the national agencies or whether they should collaborate with the national agency on registration. There might be also cases when the drug may be registered at the international level, but it is required to provide 2 more certificates, which is a batch certificate of a pharmaceutical product, and there is a point which states the following, that the drug corresponds to the files submitted at the moment of the registration of the drug. It is not easy to get this certificate. It requires time. And when we see that tenders in a country are held like twice a year, and we have to ask the potential participants to provide this certificate, then we can have a chance to have no participants in a tender. And another model of a certificate of a pharmaceutical product, each time when the participant would like to import this drug to the country, he should ask the producer. And it also takes like 2 months, and it is very difficult to have such certificates, and to the national agencies, it's very difficult to make a comprehensive assessment of the quality of drugs. So it concerns the inspection, which is from Module 2 by WHO. It should be carried out at every stage of the process, and it is not quite feasible. So what is done by the agency on procurement of the UN, they base their decision on pre-qualification of the WHO. So this is prepared in advance in the comprehensive program on pre-qualification. What does National Agency on Procurement have? So it has as a partner the National Agency on Drugs, and the mission of this agency is to provide available, safe, effective, and qualitative drugs. And then we might have a question whether the national agency has certain requirements published on their websites regarding the quality, whether they can regulate such situations when we purchase the drug which is not registered in the country. How do they manage to assess all the documents for this drug, even if there is a reference that the drug is produced on pre-qualified production lines? So why in different reports we have such terms as unknown quality of drugs, and how can we reduce the risks not to hear this term drug of unknown quality? And I have here some quotations which should be considered. So for national agencies, I think we have to optimize registration of drugs by changing the legislation, by using pre-qualification program of WHO, also program of registration procedure. So these agencies have different tools and mechanisms, and we can rely on their experience and can reduce the expenditure. As concerns the national agencies on procurement, they should have accreditation, and it should be done very actively. Also, they should have standard operating procedures because it will allow you to be sure that this is the same drug that is registered in another country. How to involve the regulatory agency on drugs. Also, we should monitor the suppliers. Another question is, how often do you apply to laboratory agency to check the quality of supplied drugs for you to be sure that you have signed the contract with an economic agent who really honors its obligations? It may be we should have a differential approach here. So this mechanism will allow to have drugs of a good quality, and they have an idea for WHO. They should help in getting these levels of quality insurance. We would like to have more projects that relate to the quality of drugs, and these projects should be done in collaboration with WHO. So we also talked about the global mechanism on drugs. You know this slide, and on this site you can easily find the information on the quality of drugs. Here you can have the policy on quality ensuring. You can find more information how they do it, how you can develop your national policy for procurement agency. And they also have recent information that concerns the monitoring of drugs quality. For example, in June 2020, a pharmaceutical plant withdraw a certain drug, and you can find out the reason and also what happens to the drug after that. We also have spoken a lot about uninterrupted supplies. That means we need good tools for assessment, for needs assessment. I think that many of you can visit this site and you will have better understanding what can be taken into the national practice.
Thank you, Rita, for such an comprehensive presentation with focus on the tools that allow to review and improve the quality and ensure the quality of TB medicines, to ensure continuous supply for reasonable prices, and for presentation of countries' experience and what lessons could be learned. Dear colleagues, if you have any questions, you can write them in the chat box and we will take them at the end of our webinar. The next presentation will be delivered by Nina Lipciu, representative of the Center for Government Centralized Procurement in Healthcare. She will tell us about the legal context, procedures, and approaches for ensuring sustainable access to high-quality TB medicines, the experience of the Republic of Moldova. Please, Nina, the floor is yours. Good morning, everyone. I will try to share my screen. Do you hear me well? Yes, we do. What about my slides? Not yet.
Так, шеринг. Надеюсь, сейчас вы видите.
What about now? Oh, we see your desktop. Good morning, I'm Nina Lipchiu. I'm a public procurer in healthcare in the Republic of Moldova. I will describe you the mechanism of TB medicines procurement in our country. Thank you very much once again for this opportunity to participate. I think that we are going to enrich our experience as a result of this webinar. Nina, you haven't opened your presentation. That's strange. You don't see it. We can see your screen, but not the presentation. I haven't had any problems with sharing before.
Рита, у вас моя презентация есть?
Rita, maybe you have my presentation and can share it. Yes, we do have your presentation. We will share it. Just a second.
Я с такой проблемой еще не сталкивалась.
I haven't encountered such an issue before.
Да. Спасибо большое.
Thank you very much. I'm sorry for these technical issues.
Дальше я хочу вам
Do you hear me? Yes, we do hear you, Nina, very well. Thank you. Thank you for the support. I will present you our legal context, procedures, and approaches for ensuring sustainable access to quality TB medicines in the Republic of Moldova. On October the 10th, 2016, based on the government's decision, our Center for State Centralized Procurement in Healthcare was established. Our center is a non-for-profit public institution with financial autonomy operating on the basis of self-management principle, and our funder is the Ministry of Health. If we analyze the medicines procurement process, we will divide the participating stakeholders in 3 levels. Ministry of Health and Ministry of Finance are in charge of policy making. The Agency for Medicines and Medical Devices, Center for Centralized Public Procurement in Healthcare, and Public Procurement Agency, and the National Agency for Dispute Resolution are in charge of policy implementation, and the beneficiaries are public healthcare institutions, economic operators, and community-based organizations. Our institution is not big. Apart from the director and the deputy director, now we also have 3 departments in charge of the procurement procedure organization. That's Department for Medicine procurement, including TB medicines, 2 pharmacists and 2 specialists. Department for procurement of medical devices. We have 5 staff, and administrative and legal monitoring department 6 staff, of which 1 pharmacist, and Department of Economic and Economy and Accounting 3 staff. About the missions of our center: planning and implementation of public procurement procedures, ensuring effectiveness and coordination of public procurement processes for the needs of the public health system, and control and monitoring of the public procurement contracts execution. We procure medicines, lenses, and ophthalmic consumables, disinfectants, medical devices, medical instruments, such materials, reagents for biochemical research and laboratory consumables, and specialized medical transport. We have 380 beneficiaries, which are represented by public health institutions of different levels, as well as accommodation and rehabilitation centers for children and the elderly. This slide shows the overall cost of signed procurement contracts in USD. We started with huge amounts, as you can see, but these amounts have been decreasing, not because we have fewer needs, but because every year we manage to get lower and lower prices due to the fact that we manage to provide quite a wide competition, and economic operators have trust in our center that everything happens legally and transparently, and we have managed to establish a very good cooperation. Based on the objective, there are 2 types of procurements organized by the center: centralized procurement to meet the needs of healthcare institutions, and procedures designed for implementation of national and special programs. We have 19 such programs currently, one of which is the National TB Control Program. On this slide, you can see that in the Republic of Moldova, by the National Law on Public Procurement, we have the following procedures stipulated: open bidding, request for price offers, limited trades, competitive dialogue, negotiation procedures, request for price offers, decision contest, purchase of social and other special services, and innovative partnerships. TB medicines are procured in open bidding and based on request for price offers. From the moment the announcement is made in the procurement bulletin and the deadline for bidding has to be 35 days for over 130,000 USD, and up to 25 days if the amount is less than 45,000 USD. We prefer open bidding usually. On average, from the date of announcement to the bidding deadline, we have from 20 to 25 to 35 days, because it is important for the bidders to have this time to be able to find the products that we would like to procure and manage to apply to present their bids within the stipulated deadline. The national TB control program in Moldova is funded from the public budget for the first line TB medicines, 100% and 50% for the second line medicines, and from the global funds, those remaining 50% for the TB medicines of the second line. And we understand that this support is temporarily, so we are working on improving our public procurement procedures to make sure that when the global fund support is going to be reduced, for us to be able to take over and provide all the necessary TB medicines to our beneficiaries. Procurement of TB medicines takes place according to the following stages. First of all, we identify the needs by a special commission is doing that within the National TB Control Program. Those needs are calculated based on a program. This commission is represented by physicians and specialists from the Institute of Physiology and Pulmonology. These needs are presented to the Ministry of Health by the 1st of August. By the 10th of August, the Ministry approves the list and also allocates budget for this national program. We have very well divided responsibilities, and everybody is responsible for their part. It is very efficient when everybody knows what they're responsible for, and this is stipulated at the level of the legislation in order to avoid conflicts of interest. That stage refers to submission of approved requirements to the center for centralized public procurement, and the deadline is until August the 12th. The center analyzes the request and prepares data required for public procurement by August the 25th. The center verifies what medicines are registered in the state registry, as well as in cooperation with the National Agency for procurement of medical devices in order to come up with the final list and specific products as well as the deadline. In procuring TB medicines, it is very important to cooperate strictly with the National Commission of the National TB Control Program, the Ministry of Health, and the National Agency for Medical Devices, because we never know when issues may arise, at what stage, and since we know that every institution has their scope of expertise, we try to cooperate closely in order to make sure that our patients get all the necessary medicines. Until the 31st of October, the center is announcing the tender through the automated system. And by the 30th of November, the center evaluates the bids and announces the results. These dates are approximate, but they are deadlines by which we are trying to finalize the corresponding stage. Of course, it might happen earlier because the deadline for bidding is from 20 to 35 days after the announcement. That is why we try to make sure we announce the tender by mid-September for the potential bidders to have those 35 days at their disposal to ask clarifying questions if they have any, and to for us to answer and for them to prepare the package of documents to apply. Our objective is to provide as much time as needed by the potential bidders to prepare everything, all the package by the 30th of November to apply. Until the 24th of December, according to our legislation, that is 11 days after the announcement of the results, and if there are no complaints from economic operators, the center signs agreements and drafts a report on the results of the procurement procedure. Of course, if somebody is willing to file a complaint, then this process might be delayed. From our experience, we see the earlier we start the tender process, the more successful it is. And by the end of the year, we manage to sign all the contracts to make sure that starting with the following year, we have everything in place and our patients have guarantees that they will get the medicines and treatment. According to the schedule established by the National Committee of the National TB Control Program, economic operators supply TB medicines to the Institute of Physiology and Pulmonology, named by Kirill Draganyuk, that distributes these products to all the other relevant healthcare facilities. Our TB health care facilities have very thoroughly thought through distribution mechanism. We have never encountered any problems. We've always known that everything is distributed according to the mechanism and with the corresponding accountability. Based on the contracts at the moment of delivery, at the Institute of Physiology and Pulmonology, those who receive the products verify whether the products comply with the requirements and the terms of delivery and sign the Receipt Act. After that, the economic operator presents the invoice for payment. If everything is in compliance, the center pays for the delivered products based on the contractual provisions. And we have a monitoring section that verifies the terms of delivery and compliance with other provisions of contracts. According to our legislation, it is also important for prices to be stick to according to the contracts, even if they are also depend on the exchange rate. They cannot be exceeded. About the terms and criteria for qualification and selection of economic operators, there are some general requirements, and according to the economic operator has to present a single European procurement document, which confirms that the economic operator is reliable. That's at the first stage. At the second stage, when the supplier, when the economic operator confirms their reliability, they need to present the following package of documents: a certificate of decision and registration of the economic operator, certificates of lack of debts, liabilities before the public budget, list of founders or of the economic operator, a certificate of bank account availability, and declaration confirming the identity of the beneficial owners and their inconsistency, and the lack of criminal record for participating in the activities. And that's at the stage of signing the agreement. Also, economic operators have to present certain special authorizations, like the license for pharmaceutical activity and GDP. According to our legislation, pharmaceutical companies need to have a GDP. It is not yet compulsory requirement for public procurement. We cannot refer to it, but that is a requirement according to the control system. Our experience shows that since we know all our economic operators, they have this certification. It has been a long way until we have got here, and we are very happy with the result. It is very important to make sure that the supply is reliable in the long-term perspective. That is why we have the following requirements for the offer. It has to contain financial offer, technical proposals, guarantee for the offer, provision, a declaration of the offer validity, application for participation, and at the moment of contract signing, we also ask for a document to guarantee the proper execution of the contract. According to the current legislation, if the package of documents doesn't contain any, or some documents are missing, we have the right to request for those documents to be presented additionally. In the tender procedure, only registered medicines in the Republic of Moldova can participate. And that is in the case when we have at least one registered medicine in the National Register of Medicines. At the moment, we have only 5 out of 15 TB medicines registered in the country. In case there are no registered medicines, then non-registered medicines are eligible, but additional quality certification documents are necessary in this case. I will explain later. So we shouldn't be scared by this number of 5 out of 15, because last year, it's just that last year the registration term of some of the TB medicines expired. But we are sure that these companies have applied for registration already. This slide shows the TB medicines registered in the Republic of Moldova currently. Out of the 5 products, 1 is pre-qualified by WHO and 3 are registered by other regulating authorities. And since we have this cooperation between the Center for Centralized Public Procurement and the Agency for Medicines and Medical Devices, we know that currently the agency is examining 6 applications for TB medicines registration. This means that next year we hope to have 11 TB medicines registered already. How do we procure unregistered TB medicines in our country? In case these are eligible, additionally, we request the following documents confirming quality, and that is GMP certificate and WHO pre-qualification status. But if in the absence of proposals with WHO pre-qualified medicines, then we assess the proposed medicines for which they present the latest report on the inspection of the production facility, which must be valid for at least 3 years from the date of inspection, or that are allowed by FDA or EMA or national competent authorities of EU member states, or at least one of the following countries: Switzerland, Canada, Japan, Australia. And even if we have a low price offer, but that is not a WHO pre-qualified medicine, then we are going to prefer the other medicine that has WHO pre-qualification, although it might cost more. In November of the current year, in the Republic of Moldova, a joint registration procedure has been added for WHO pre-qualified medicines, and this procedure stipulates 45 days for examination of offers. After import, all TB medicines undergo state quality control in the laboratory for quality control of medicines at the Agency for Medicines and Medical Devices. This is done within 40 work days from sampling. And this control includes initial control or a follow-up selected control. In case medicines are registered by EMA or by the national competent authority of one of the member states, Switzerland, Canada, Japan, Australia, and FDA USA. The decision of the Committee of the Agency for Medicines and Medical Devices is based on lack of any quality deficiency in the first 5 series of TB medicines. So quality control is performed by the Agency for Medicines and Medical Devices. And I would like to say that they have a very well-equipped laboratory for quality control of medicines at the European level, I think. And all the medicines that undergo quality control by our agency, we are absolutely sure that these medicines are of high quality and they have been through a thorough control procedure. And terms are very important. Our our agency works quickly and efficiently, and I would like to thank Madam Gudima for this. This slide shows prices in USD for TB medicines received by the Republic of Moldova after conducting the national public procurement procedures prices compared comparative prices for Inca terms DDP, VAT excluded, and then the GDF prices, Inca terms X works, plus 24%. That includes customs fees, transport services, and other expenses. We can see that the price range, but as far as we know, there are also limits for prices established. Also, there are drugs that exceed the price highly. For instance, bedaquiline, it's almost 4 times. We understand that this is regional patented medicines. It hasn't been procured before. And of course, when you start procuring something new, the price might exceed what you expect in the beginning. I would like to say a couple of words to add to the previous slide. The overall cost of all the contracts for TB medicines within the last 3 years. If in 2019 we procured TB medicines for just over $1 million USD, in 2020, that price slightly grew, but that's because of COVID. But already in 2021, we managed to save, and we procured TB medicines for just over 960,000 USD. So the trend is clearly seen. We have managed to save some money. Challenges and solutions. The first challenge that we have encountered within recent years refers to non-fulfillment or improper fulfillment of the terms of the contract by economic operators. And that refers to non-compliance with the delivery terms or quantities. Our economic operators try to combine 2 or 3 tranches because that is cheaper from the logistical point of view, but we are not always happy with their proposals. So as a solution, we see framework agreements to be signed for public procurement in 2022. That will be requirement for centralized public procurements, and that will let us reduce the bid terms. And because for now we are only conducting, conducting open bidding. The second challenge refers to the fact that monitoring of contract execution is implemented on the basis of reports on paper provided by economic operators and healthcare institutions. So as a solution, we see an integrated electronic medicine inventory management system, a software for all the stakeholders to have access to that system. The Ministry of Health, the National Committee, our center, and to make it possible for us to control and monitor the entire process at all stages. At the same time, this software or an electronic mechanism would allow us to analyze data for the last 4 or 5 years to be able to forecast and to plan, to do long-term planning and calculate. Another challenge that we have encountered refers to the fact that any economic operator, non-resident in Republic of Moldova, also can participate in our public procurement, but there is an issue related to electronic signature. Documents can be filed, can be submitted when all of them are signed by the electronic signature. Currently, our country is negotiating with the EU countries and some of the CS countries to mutually recognize these electronic signatures.
Да, спасибо большое за...
Thank you. And as a solution, we see the need to amend the legislation for the recognition of a foreign electronic signature. And the government of the Republic of Moldova currently is negotiating with the EU member states, and I think by the end of 2022, this issue will be settled, and foreign economic operators will be able to apply within our public procurement procedures. Another challenge refers to the limited availability of TB medicines due to high prices for patented medicines. For instance, bedaquiline, used in TB, in MDR TB treatment. In the Eastern European and Central Asian countries, up till 2027, there will be minimum, if nothing is changed. So as a solution, we think we could revise the legislation to be able to procure generic drugs based on TRIPS agreement. On the 8th of April 2021, 17 patient organizations in Eastern Europe and Central Asia have applied JSON company to take measures to increase access to bedaquiline and consider the possibility to provide an open license to ensure access to cheaper generics of bedaquiline. Brazil, India, and Thailand, there are such possibilities, and there has been an appeal to the governments of countries to consider this issue. Other challenges refer to chronic lack of offers for bids for some of the TB medicines because of reduced quantities or reduced amount. As a decision, we could see combining several TB medicines into a single lot to attract offers, 3-4, for instance, as well. Certain pharmaceutical companies will consider the financial side, first of all, and it will be more efficient for them or more attractive to file a bid for all the 3 or 4 TB medicines. Another solution would be a joint procurement or joint price negotiations with the manufacturers of TB medicines in Eastern Europe and Central Asia. Using the example of WHO, Baltic Procurement Initiative, Benelux Initiative on Pharmaceutical Policy, Nordic Pharmaceutical Forum, and procurement with the help of international organizations, GDF, UNDP, and UNICEF. I would like to finalize my presentation by saying that despite the fact that currently our legislation gives us all the everything, all the conditions to be able to ensure transparent public procurement, and but still the public procurers have to consider 2 or 3 or 4 even possible options. What happens if one tender is not successful? What measures we can take, what decisions we can make correspondingly. So we always have to consider partnerships with the international organizations and, of course, companies that are already are engaged in TB medicine procurement and can assist us, can help us if needed. And we always have to consider the experience of our countries. In the last webinar we participated in, we learned about the experience of Armenia when they are considering prices of international organizations, and that is a ceiling price for the economic operators in the local system. And then they decide to procure from those who give an acceptable, a reasonable price. That is a very good exercise for the national campaigns, for national companies that understand that if they're not competitive, they will lose their market. We really like that solution. So maybe we will consider such an opportunity in the following years. And also we would like to ensure to have cooperation with GDF. And maybe their experience is much better than ours. Thank you very much for your attention. And I hope, and if there are any questions, I will be happy to answer. Thank you.
Thank you, Nina, for your presentation and for the presentation of the experience of the Republic of Moldova. Now we will listen to the presentation from the Republic of Uzbekistan. It will be presented by Hassan Safayev, who is an expert on drug management of the Republican Center in Uzbekistan. The floor is yours, Hassan. Thank you, Lina. I would like to present my report. Starting with 2001 until 2006, the procurement of TB drugs in the Republic was realized from funds of the government of Germany. KF 1, 2, and 3. And since 2007, TB drugs of the first line were purchased from grants of GDF and Global Fund. And during these 12 years, all the necessities in TB drugs were covered by Global Fund drugs. Also in the Republic of Kazakhstan, since 2008, we have the organization of Doctors Without Borders, and we also provide support in purchasing TB drugs. We now use all the TB drugs of the first and second line for adults and children. The general mechanism for purchasing TB drugs within a global fund grant is the GDF mechanism that provides not only supply of drugs, but technical assistance to our partners, to our country. The full range of services of GDF includes a lot of things, accessibility to negotiable prices, and the price is much less than the market price. Since 2018, we have new drugs that are provided through this mechanism, delamanid and bedaquiline. So also we should mention here shorter terms of supply, and also the possibility of tracing for the supplies at the GDF site. We can trace and track the supplies, and we can have all the documents on this site. And also we have to mention here the qualitative supply service. Within the framework of negotiations between the Ministry of Health and Global Fund, since 2016, Uzbekistan should buy 100% of TB drugs of the first line, and then gradually by 20% should organize the procurement of the drugs of the second line. But you can see on the slide the highlighted price from the state budget. It was given only 5% for TB drugs of the second line. It was our first experience in a state procurement, and the country has selected the mechanism of procurement through PRO-ON, and starting with 2017 till 2020, we had challenges in allocation of the state budget, and we applied to Global Fund for purchasing first line drugs. The Global Fund never refused us, and since 2020, we managed to go to state procurement of drugs for the second line as well. Based on the decree of the president, for 2020-2021, there were allocated funds for drug procurement, and how this works in Uzbekistan, we need the order by the president, where it will be stated what is the financial means and the budget for procurement of these TB drugs. And usually in February, such document is issued. And point 16 stipulates that TB drugs should be purchased from International Mechanism Global Drug Facility. And within the framework of a new order for 2022, we have planned a certain sum of money for purchasing TB drugs for 2022-2026. And we also mentioned there that the procurement mechanism will be a centralized one through international mechanism GDF. We also stipulated here that we will purchase drugs for latent tuberculosis infection as well. We need to know distribution of financing. I mean here by the number of patients and by the sum of drugs purchased through global fund or from government budget. So second line drugs also pose some challenges for us, how to calculate the number and the volume depending on the number of patients or on the sum of supply, because we know that second line drugs become less expensive each year. And we decided to base this calculation on the number of patients identified with MDR-TB. And in the national plan, it is stipulated that each year approximately 3,000 patients are identified, and we have calculated the profile of drug resistance, and each year we increase the percentage of government budget for these drugs. Dear colleagues, we have some technical issues. So we are waiting our colleagues Safayev Hassan back with his presentation. And until we are waiting for Hassan Safayev, if you have any questions, please write them in the chat. If you have any questions to Rita, Aygul, Nina, please write them in the chat box. Dear colleagues, do you have any questions to our speakers? So we have the first question in our chat box from Nina. And the question is for Aygul, if you can buy unregistered drugs during the procurement procedure. Yes, we have such a practice. We have an opportunity to purchase unregistered drugs, but this happens in case of emergency situation or in case we have a certain urgent epidemiological need, but the Ministry of Health and Expert Organization issue a special approval for importing these drugs once. The drug is imported in Kazakhstan, and this Pharmacia takes the obligation to monitor the package, then to provide the instruction for this drug in a national language, and these expenditures are incurred by our corporation. And also I would like to add that purchase of TB drugs, the application to our organization includes not only the needs for the year, but also a 2 months stock for supplying TB drugs to patients. Yeah, also our organization purchases like 25% of all other drugs on our own means, and it is done to provide uninterrupted supply in case of force majeure circumstances. For example, when a supplier fails to supply drugs in time, and we have this stock just in case there happens some problems, not to have risks. Thank you, Ms. Aykul. We hope that our colleague Hassan will be able to join our webinar, but if you have any questions right now, you can ask them, or maybe you will answer the question. So what are the critical issues do exist in procurement of TB drugs in your experience? Maybe you had such an experience as it was mentioned by Rita in her presentation. Can you share your experience in this? So no reaction. So it was a question for me. It is a question for all the participants of webinar. So I can say that now we are working on improvement of the system of purchasing, and today we consider the possibility of participation of inter-country purchases, and we plan to have inter-country procurement with Arab countries. And we also are interested in such situations. So when for one drug, we have a short list of suppliers, but unfortunately, the legislation does not allow us to create such a short list because we have certain rules and regulations. The Ministry of Health should approve our list, and then we divide this list into certain categories of drugs, like original drugs, generic drugs, We also separate the drugs who are produced by our local producers with whom we have long-term contracts, then the category of drugs that are provided by international organizations because they are of good quality and they allow us to have less expenses. With local producers, we have 10 years contracts. And with international suppliers, we have contracts for 3 years to have a financial interest on the side of a supplier. With international agencies, we also have long-term collaboration and we do not have issues, but unfortunately we cannot make up a short list. When we make up a contract with the supplier for a certain volume of products, and when the medical organization has an additional need in these drugs, or we have an outbreak of a disease, so or some other circumstances, it happens quite rare, but still it can happen. Then we have to announce tender once again, and it is a long-lasting process. And now I have a question: what algorithms are available right now, or what possibilities do exist now to preserve this short list of suppliers? We can modify our legislation to some extent, but in case we have such a short list for each drug, we can mitigate the risks of shortage in supplies, because the experience of Arab countries shows that they have this short list and it works quite well. Maybe the colleagues have the same experience. Dear colleagues, please, if you can share your experience. We are waiting for answers. We have questions for Aygül. Whether your national producers participate on international level in public procurement of other countries. So the second question, I understood the question. So for the first question, I can say that we purchase drugs for Kazakhstan. We do not export drugs, but I want to say that our suppliers, especially top 10 suppliers, they export quite large volumes, and probably they do participate in tenders, but this is business and this is not our terms of reference, but still I hope, I think that they do participate in international tenders as well. And based on the information we receive from reliable agencies, our suppliers, our national suppliers export quite a large amount of drugs on the international market. So, and the second question, we conclude a contract, a kind of intention contract for 10 years on the territory of Republic of Kazakhstan, and we conclude this contract for a production line, and when this production line is ready, The main condition is that this drug should be on the list of a distributor. There is a certain algorithm of actions. This drug should be included into the protocol. And when it is on the list, we can continue our work with our suppliers, and we can sign an additional agreement with our supplier. Still, we can have some risks here because the protocols can change, but this is the risk for supplier, and the contract is valid for 10 years. So the supplier should make some studies and study the prospects of the drugs. These are business risks, but unless the drug is not taken away from the list of drugs, we continue collaboration. In case the drug is withdrawn from the list, then we cease the contract. I would like to get more details. Do you have a price which is stable for 10 years? Or you just conclude a contract and you do not stipulate the price? May it happen so that at the end of the second or the third year, the price will be bigger? And what is more good for you to stick to this contract for 10 years or to announce tender each year? So each year we discuss the maximum prices, and our unique distributor can purchase drugs only if their price is under the maximum price established by the Ministry of Health. Yes, we negotiate the price, and the price should not be higher than the one approved by the ministry. And each year, our suppliers should make reduction of prices, a certain percentage, and it is stipulated in the contract that the price should not become higher. Still, in certain cases, these drugs produced by local producers are a bit more expensive than those provided by foreign producers or distributors. But this initiative is focused on the support of national producers, and the state provides support to make them available, to make them work for the country. But I can say that the prices are not higher than the limited ones, and our margin is the minimum. Anyway, we buy not for high prices. So thank you for detailed answer. Thank you. I would like to comment for Aygul. Did you think about identifying 2 or 3 winners and then divide this volume for 2 or 3 suppliers to make the availability of drug possible? So also GDF has in its long-term contract such a point just to distribute part of each participant for a certain drug. If somebody from GDF is present, maybe they can comment. Thank you, Rita. Yes, so we are thinking to distribute it in parts, like not giving 100% of a lot to one single supplier. And that is why I ask about your experience, because right now we are considering this opportunity to share these volumes. And we are thinking about our inter-country with Arab countries. We have intergovernmental agreement signed, and one of the points is common purchases with Arab countries. And this year we are going to pilot this mechanism and share the experience with Arab countries, because the procurement agency in their country does not have too many documents that regulate the procedure, because as I shown, 6 documents regulate the process of procurement, and we are not flexible in this regard. Therefore, the international experience would be very useful for us. Maybe it will be possible to implement it. And your experience also will be very interesting for all the rest of participants, because it's a starting point. You should have the same players that have their drugs registered in Kazakhstan and some other countries. If such norm as registration of the drugs is present in their legislation, and I think that we will hear about your unique experience in the nearest future. Yes, you're right. The state registration is very important, and this issue should be considered and solved in our pilot project. Thank you, Aygül. Hassan, please tell us if you can connect and finish your presentation. Yes, sure. So, please, can you tell what slide I stopped? It was slide number 9. As I told, based on the legislation of Uzbekistan, we managed to introduce in the order by the President of the Republic the mechanism of purchasing TB drugs through GDF, and certain sums were allocated for this procurement. In 2017, we established a department at the Ministry of Health, who is in charge of procurement of drugs, and they were in charge of holding tenders. And we had the following issue here. They could purchase first-line drugs, 100% of them, but as concerns the second-line drugs, we had another supplier, and we might have the following misunderstandings. First of all, Global Fund buys quality products pre-qualified by WHO and so on. And our state organization could purchase other drugs, and there might happen such a situation that in one ward there might be a patient administering drugs bought by Global Fund, but next to him is a patient who administers drugs purchased from state budget. More than that, the drugs were not registered in the country, and the tenders could be organized only for registered drugs. So, and we have as an option the procurement through GDF mechanism, and in a new order, we also stipulated this mechanism of centralized procurement for the next 4 years. And besides that, we plan to purchase drugs for people with latent TB infection. Before that, they were purchased by means of Global Fund. As concerns the distribution of financing, we decided to base our calculations on the number of identified cases. So first line, drugs are covered by the state budget. And the second line, drugs are bought according to the calculations of our national strategic plan, which stipulates identification of 3,000 patients each year. And we have 10% increase each year, and the state will buy more drugs depending on the number of patients. As concerns the preventive treatment of TB, the major part is bought from the state budget. And here you see our first experience in November 2020. We have signed a four-party agreement with the Ministry of Health, GDF, IDA, and at the end of 2020, we have transferred the money to the bank account of IDA, and you see that the drugs started coming to us within 2 months. We also do this procurement in certain stages. We can divide them in certain lots, depending on the stock we have available. For example, in February 2021, it took a month to transfer the drugs to the warehouse. So we had to conclude an agreement with airports. We have to transfer money to them, and this issue was solved during a very long period of time. It took about a month to solve this issue, but once we have this agreement for a year, the next supplies took like 1 week to get our lots of drugs, and we could save some financial means when we have some options for their storage, like a warehouse that belong to our organization. Now we can store our drugs at our own warehouse. And I would like to pay your attention also to the fact that at the beginning of the year, to our account, they should transfer money, but taking into account the epidemic situation with COVID, we could not have access to money funds, but I think the situation with COVID will be more or less stable, and at the beginning of the year, we will have access to our funds and we will be able to get procurement procedures. And since we have our own warehouse and store drugs there, we have another issue, how to import our drugs to the country. And the option was to have a single approval by the Ministry of Health. And for the first time, it took like 2 months. The first lot took a long time, and we had a lot of experience, not always quite positive. We had a lot of challenges. We have considered all the legislation documents on procurement of the Republic of Uzbekistan, on customs clearance and so on. And when we had the next supply, then it took less time. And I can say that we can reduce this time period until 1 month time. We can have these agreements concluded, and the process is quite clear for us. And we know that we can use this option to have a single approval to import the drugs, and everyone will facilitate this process. And then we will have a quality control process available, and it takes like 2 weeks. So we had $60,000 US dollars for this expenditure, and we were able to save $25,000. And the Ministry of Health agreed that we will use this sum of money for further procurement. So it was our Ministry of Finance that helped in it, and we could use these funds because the process of state purchase TB drugs are in charge of Pulmonology Institute, and this was our first experience. And at the national level, we do not have a lot of experts in the procurement process. So it was a kind of challenge for us. We had temporary challenges related to single approval of importing a lot of drugs. Then there were issues concerning value-added tax. We had to pay 15% of the price, but due to the assistance from our state agencies, we were able to solve these issues, and we were able to make a free of charge quality control and we were able to save some funds. And here you see the list of legislative documents that helps us to carry out all these activities. The law of the Republic of Uzbekistan on protection of population from TB. And one of the points stipulates that patients should be provided with TB drugs free of charge. Based on this article, we were able to do all the procedures that are required for purchasing the drugs. We have law on state procurement, law on drugs and pharmaceutical activity, and there it is stipulated that we can import drugs without registration in certain cases, in case of dangerous infections and those who are presenting epidemiological threat. More than that, we have the law of the Republic of Uzbekistan on state purchases, which stipulates that we can organize the procurement process based on contracts and order by the President of the Republic of Uzbekistan. And we used this opportunity and completed the order by the President by the point that allows procurement of drugs through international agencies. So I would like to draw your attention on points 6 and 7. It concerns the list of drugs that can be procured using direct contracts with supplies. We were not able to include all TB drugs that we use in Uzbekistan, except we have just started using it, and therefore it was not listed there. We also have a list of basic drugs, and it is updated in February 2021. And there we have all necessary drugs for TB patients, starting with TB drugs of the first line, second line, and other new drugs for children. So now we have 7 drugs that are registered out of 29 drugs we use. I would like to say that cycloserine from South Korea was registered by a special procedure. Within 60 days, we were able to register this drug. Usually, registration for one drug costs like $10,000. But if we use this rapid mechanism, the price is reduced to $6,000, and it allows to the suppliers So we again have technical issues, dear colleagues. Unfortunately, we are running short of time. And please, Hassan, just few conclusions. So please connect your mic. So it was my last slide. And I would like to express my gratitude to the Ministry of Health, to our state authorities who helped us in purchasing TB drugs, and special thanks to GDF organization that helps us in registering procedures, and therefore it helps to the producers to use rapid registration methods, and also to those who helped us in calculating our necessities. Thank you, Mr. Hassan. We are glad that you had the possibility to finish your presentation. Unfortunately, we have to finish our webinar. We express our thanks to our speakers, to Ms. Rita, Aygül, Nina, Hassan. We are very glad to hear about your professional experience. If you have any questions, please, you can write to the organizers, and you will have all the presentations sent. So wish you success, good health. Goodbye.
Большое спасибо. До свидания.
Спасибо большое за участие.